Good evening, Berkeley. Hope you and your family are safe during this very difficult time, and thank you for joining me for this Wednesday update on the city's response to COVID-19. I'm Jesse Edegin, your mayor, and I want to first start out by thanking our dedicated city staff and essential workers, our healthcare workers who are on the front line, and those in our community that are supporting our healthcare system, as well as our community who has really stepped up during this very difficult time. I'm really proud that our community has really come together and is supporting each other. And even though we can't be close to each other, I think we as a community have been closer and stronger than ever, whether it is helping elderly neighbors or neighbors in our neighborhood get access to groceries or medicine, whether it's sewing masks or organizing donation drives to donate personal protective equipment to first responders and frontline medical staff, or whether it's supporting our small businesses, either through buying meals from your favorite restaurant or donating to the Berkeley Relief Fund to support our restaurants, our businesses, and our arts organizations. I'm really proud of how our community has really come together. So just to provide an update on the number of confirmed cases in Berkeley, as of this morning, we have 40 lab confirmed cases, and we know that that does not represent everyone in our community who has contracted COVID-19 due to limited access to testing. Sadly, we learned last week of one death of a Berkeley resident due to complications related to COVID-19. We have one individual who is currently hospitalized, and of those 40, 27 have recovered. And once again, this is a reminder that we must stay home to save lives. And I'm really appreciative of everyone in Berkeley who has followed this shelter-in-place order. I know it's challenging, but you are saving lives. And if you do leave the house, please stay 6 feet away from others. Please wear a facial covering. We know that COVID-19 can be contracted just through breathing or talking. And please do your part to follow these important health and safety precautions. This is not only about protecting you, but also about protecting others, because we know that some people who have contracted COVID-19 may have mild or no symptoms at all, and they can spread the disease to others. So please follow these measures to help slow the spread of the virus in Berkeley. Know that you are doing your part and that it is making an impact. And please do your part to follow these important health and safety precautions. So just to provide a few updates on actions the city and other agencies are engaged in around COVID-19. Once again, we are accepting donations of masks, gloves, and other personal protective equipment to support our response to COVID-19. If you have supplies, please visit our website, cityofberkeley.info/coronavirus for details. Yesterday, Governor Newsom in his press conference announced 6 key indicators that will guide the state's decision on whether to lift the shelter-in-place order. And we are looking to this guidance in our own decision about whether to lift the shelter-in-place order. And just to touch on these 6 indicators, they are the state's ability to monitor and protect our communities through testing, contact tracing, isolating, and supporting those who are positive or exposed. The ability to prevent infection in people who are most at risk. The ability of our hospital and healthcare systems to handle surges. The ability to develop therapeutics to meet the demand and also to help deal with the symptoms of COVID-19, to manage the symptoms of COVID-19. The ability of our businesses, our schools, and our childcare facilities to support physical distancing, and the ability to determine when to reinstitute certain measures such as stay-at-home orders if they are necessary, if we are seeing a surge in cases. It is important to note that while our efforts to shelter in place early and practice physical distancing have helped minimize cases and spread out cases, they have not ended them entirely. And so when this order is lifted, we know that there are going to be more cases. So we know that there are people who are going to be exposed. And so we will need to put in place measures and precautions to make sure people, particularly people most at risk, can be safe. Sadly, we are not going to be able to go back to business as usual, that our lives are going to change. And until such time that we have a vaccine that is readily available, we are going to have to take the guidance from our health officers very, very seriously. But please know you are doing what you can to help save lives. So in Berkeley, our public health officer is looking at the data, looking at the modeling, and we'll be looking to the state's guidance in their analysis to determine when to lift the order in Berkeley. We do not have a timetable yet, but that decision will be based on data and when it is safe to lift the order. An update on our efforts to address homelessness. Just today, Our city staff in multiple departments transported 18 individuals, medically vulnerable, non-COVID positive people who are homeless, to hotels in the city of Oakland. This is part of a program in partnership with the state of California, the county of Alameda, and many service providers that are referring people that are symptomatic with COVID-19 or are susceptible to COVID-19 to hotels for isolation and for safe shelter. This really was a multi-departmental effort. Staff and Aging Division used paratransit vans to transport people, not only to get tested, but also go to these hotels. And our shelter staff will be working with those individuals to help them ease and to also make sure that they can maintain access to essential meals and services. This is part of a multi-departmental effort by the city of Berkeley to help our homeless during this very difficult time. And that includes not only access to hotels, but trailers. We're going to be creating a larger shelter to provide shelter and adequate physical distancing for people. People that are in our shelters are living in very cramped quarters, and we need to have better physical distancing. We are expanding access to showers, sanitation, and other essential services. And lastly, I want to let you know that this Saturday, April 18th, at 12 o'clock, we will have another online town hall with our city manager, D. Williams Ridley, and our health officer, Dr. Lisa Hernandez, on the city's response to COVID-19. And we encourage you to participate. We welcome your questions. We will be sending out information about how residents can submit questions that we will pose to Dr. Hernandez and City Manager Williams Ridley. And please tune in to our town hall by visiting the Berkeley Mayor Jesse Edegin YouTube page or Facebook page this Saturday, April 18th at 12 o'clock. We look forward to your participation and to be able to answer your questions. So in closing, please continue to do your part to protect our community. Please stay home to save lives. Please practice physical distancing. If you do go outside, please wear a facial covering. We know that we are seeing a surge in cases, and so everything we do will help not only protect yourself, protect your family, your neighbors, but also your community, and will help flatten the curve. So please visit jesseedegin.com for our resource guide, and I look forward to seeing you on Saturday. Please be safe and healthy, Berkeley, and see you soon.